Facebook family. I'm going to be cleaning while you and I talk about the importance of having our mammograms done annually, especially after a certain age. Males also get diagnosed with breast cancer, so it's important for us to know that fact. But women are more prone to developing the disease than men, especially if our mother or sibling, a close relative, was diagnosed with the disease. Mammogram is the single most effective tool for early detection of breast cancer. It is also important to note that mammography is relatively inexpensive, and especially when compared to other modalities like ultrasound, MRI, CT, you name it. It is fast and efficient and can be used in a large-scale screening of the population. During your mammogram screening, it depends on the tech that's performing the exam. It takes between 6 to 15 minutes to perform. And we, especially women, should understand how important it is for us to keep up to date with our annual screening. Women, we'll say between the age of 40 to 44 years, it is recommended to have our mammogram every 2 years. And then between ages 45 upward, you should have your annual mammogram annually. Me, as a mammography tech, I've observed that many of the patients that I see waited up to between 3 to 18 years before their next mammogram, which is not good. And most times when I ask why they take so long to come for their next mammogram, their reasons would be because of the radiation or because they're afraid of the compression. They were traumatized from the year before, so they decide not to have it done anymore. But this is not good concept, because if you wait that long, sometimes when you come in, it's too late because you have the disease and it's gone too far to be fixed. Studies where the radiation is concerned, studies show that the radiation for each breast exposed to radiation is only about 0.4 millisieverts of radiation. And we should be mindful that radiation is everywhere. The sun gives off radiation. You have radiation from your microwave that some of us use daily. And when you're using the radiation, you're standing right up close by to the unit, watching the food getting warmed or cooked or whatever you use it for. You also get radiation when you travel on the airplane. You pass through security. They scan you. It's radiation that they use to scan. You notice your entire body shows up on the screen. That's radiation. And most of us don't give any extra thought to that. You sit on the airplane for between 3 hours to 24 hours, depending on how far you're traveling. And you're sitting here exposed to radiation. So I would encourage us that the cause to do annual mammogram screening outweighs the effect of not knowing your results and catching the cancer before it's too late. I know mammogram screening compression can be uncomfortable and sometimes painful for some women because of their breast size and density, but the compression only lasts for a short while. So to be in the know is worth holding your breath and cope with the discomfort. I must also remind us again that men can get diagnosed with breast cancer, but the disease is more common in women. Breast cancer is the most common cancer among women in the United States. Breast cancer develops mainly in the women older than 50 years, but it can also develop in younger women. Breast cancer is the second leading cause of cancer death among women in the United States. Lung and bronchial cancer is the leading cause of death from cancer. Approximately 13% or 1 in 8 women will be diagnosed with breast cancer in their lifetime. Study also show that approximately 1 of every 100 breast cancers diagnosed in the United States is found in men. Approximately 1 in 39 or 3% of women will die from breast cancer. The median age of breast cancer diagnosis during 2012 to 2016 was 62 years old. Overall, the incidence of invasive breast cancer in women has been steadily increasing since 2004. However, the death rate has decreased almost 40% from 1989 to 2017. So ladies, please, with this information, don't put off your mammogram screening. It is better to be in the know and catch it early than put it off and then it's too late. And you know what happened if you're diagnosed and it's too late. Please, ladies, don't put off doing your mammogram screening. Remember, too, men that are listening, don't put off your screening. If you should feel a lump, go check it out. Even though sometimes it's just gynecomastia, which occurs because of certain blood pressure medication or too much smoking of marijuana.